And in a UW study, nearly half of all respondents, including doctors and nurses, said the pandemic has reduced their likelihood of staying in their current field. So now several major hospitals around the state are surpassing full capacity levels, and we found out it's not only because of COVID patients. Ted Land is joining us tonight. And Ted, what are they trying to do at this point to free up some beds?
Well, a number of things, Jessica, but it'll take time to address the crowding many hospitals are experiencing. We found out many long-term patients just have nowhere to go. At times during the pandemic, hospitals were packed with COVID patients, and there was not much room for anyone else. Today, many Washington medical centers are still crowded, but it's not because of COVID.
Hospitals are at or exceeding 120% capacity in some cases, which in those hospitals that are experiencing it are historic highs.
Here's the problem. The Washington State Hospital Association says most of the beds are occupied by patients who really should be in long-term care or skilled nursing facilities.
Many have severe dementia or other challenging behavioral conditions. Some have complex psychosocial, financial, or other barriers. Our problem is that these vulnerable but not acutely ill individuals occupy inpatient beds and require the same limited hospital staffing needed for other patients with more severe acute medical problems that need our care.
So why aren't long-term care facilities taking those patients? Many of those places are dealing with staffing shortages.
Right now, they've got the space. What they really need are the staff. Staff in nursing homes do really hard and important work, but it's physically hard.
The backlog is causing some medical centers to delay procedures.
Last week, patients had to wait for a delayed heart valve replacement and for removal of cancerous tumors involving the colon.
The Hospital Association has some ideas for relief in the near term. It's asking the state to speed up the process of assessing long-term care patients so they can move out of hospitals into the limited spaces available in nursing homes. The association is also pushing for pay increases to help address those staffing shortages.
It's really important to be able to get those payment rates for nursing homes increased so that those staff are incentivized to stay and know that they're being recognized for that hard work that they're doing.
Advocates are also pushing for some changes to state law to allow family members to make decisions about moving a patient to long-term care. They say that would free up hospital beds. And they say they were encouraged to see money in the governor's proposed budget this week for placing patients in long-term care. But that process must first go through the legislature, so that will take a lot of time.
Okay, Ted, thank you. And we do want to hear from you at home. Have you had a friend or family, or perhaps yourself, have struggled to access long-term care? Let us know by texting us 206-448-4545. And of course, we'll be sure to keep an eye on this story as it develops.